Hi, Kathy. Thank you for the kind introduction. I'm very excited to talk about the summer coming up, and the weather is actually collaborating with me, given how beautiful it has been these past few days. Summer definitely feels like it's up in the air. Um, Given that, we do want to be mindful of a few general things to keep our bodies safe so we can continue enjoying, and the children can continue enjoying having a wonderful summer with their friends and family. So my today's presentation is going to briefly touch upon some of the overarching topics about maintaining good health and some preventive care um, on topics related to summertime. If at any time there are some questions, please feel free to put it in the Q&A in the chat section. I'll take a look at it at the end of my presentation. All right, Kathy, next slide, please. So just an outline of what we're going to be talking about today, and I'll do a deep dive on each of these topics. So first off, we'll start off with hydration. Next slide, please. So we can imagine hydration is key when it's super hot, and water is the best and most essential source of maintaining hydration. It is important as we know that 70% of the human body is made up of water. So to keep your hydration levels high and up ensures that you have good energy levels to go about the day. Also important to remember, when it's super hot, our body has mechanisms to cool itself down by the way of sweating. So we lose a lot of water through our body when we're sweating. Hence, also important to replenish those water stores by drinking water. Next slide, please. The next question I commonly get asked is, yes, we should be drinking water, but for an adult, we know about eight ounce cups in a day, but how much should my child be drinking? So an average rule of thumb is they should have 8 ounces of water per year of age per day. So for example, if you have a 5-year-old at home or a 6-year-old at home, so 5-year-old should be having at least 5 8-ounce glasses of water in a day. Next slide, please. And one other important way of knowing, now these kids also have quite a tendency of taking a sip of water and going out and about, going ahead and playing. So at the end of the day, like, did they really drink enough water or not? One quick rule of thumb to follow and to see if they're well hydrated or not is checking their urine color. I very commonly talk about this to all my patients of all age groups, being like, take a look at the toilet bowl once you're done peeing. The color should be similar to the color of what you're drinking, saying which is like the urine should be clear to pale in color. The darker it is, it indicates that your body is really trying to conserve water, and it's a very concentrated urine that is being passed, indicating that you need to drink more water. So from a younger age itself, I encourage kids to keep looking and checking, like, oh, you just peed, take a peek. Is it pale, yellowish? Great, awesome, we're doing a good job drinking water. If not, it's really dark or it's darker than usual, almost orangish, that's a problem. We need to go drink some water right away before our body gets into any kind of trouble. Next slide, please. So there are, of course, different things that kids would prefer to drink. Some kids love water, other kids not as much. Sports drinks, so like Gatorade, juice, things like that. I'll talk about sports drinks first. They're typically made for athletes. It contains a lot of electrolytes. So while they're good, it is recommended for kids participating in team sports or in activities where they're actively losing a lot of water and electrolytes at the same time. It is not meant for a daily casual, like play in the park in the summertime. A few sips here and there is okay. However, for children, consuming sports drinks can actually do more harm than good. Firstly, because of the sugar content in the drinks. And secondly, some of these sports drinks also have caffeine in it, which can adversely affect the child depending upon how old they are. So rule of thumb, stick to water for everyday hydration. The other thing is also juice. Of course, it's summertime, it's time for fun. A key is to balance things out. Can kids drink juice? Yes, of course. It's part and parcel of enjoying summer. However, doing it in moderation is going to be key. Because again, juices have a lot of sugar, even if it's completely pure, natural orange juice that you have just taken out, like freshly squeezed orange juice. However, just keep in mind that to squeeze a cup of orange juice, for example, an 8-ounce cup, you might need 2 or 3 oranges. Versus if the child were to eat, they probably won't eat more than 1 orange or max 2 oranges at a time. The reason is because they're also consuming the fiber along with the sugar content of the fruit. So, yes, even if it's completely 100% natural juice, still try to limit the juice intake. Prioritize eating the fruit over drinking the juice. Next slide, please. The next topic I wanted to talk about is sun protection. Now, it very, very, very important again. A few different tips and tricks. Barrier protection, so making sure that the kids have a hat on their head. Dressing in, if possible, full sleeve clothing, which have the UPF label. So I always recommend rash guard swimsuits, which have a full sleeve, just because then that way when the kids are out and about in the sun, we're not that worried about them having excessive sun exposure. Also trying to keep the kids out as much as possible where the sun exposure is very high between the hours usually of 10 a.m. to 4 p.m. or at least have areas where there are shaded where the kids can sort of come in, take a break, go back out. For really tiny babies, for our infants less than 6 months of age, they shouldn't really be in out and about direct sunlight. And if the baby's out at the beach or something like that, make sure that you have some sort of a canopy. It could be a part of their stroller bassinet where the baby could be in there, or these really cute tents that are made that can be set out at the beach where the baby is in there. So yes, the baby can be outdoors, but avoid having the baby out in direct sunlight. Also, again, if the baby's out, make sure that their head is covered with a hat, full sleeve clothing to protect their skin from the UV exposure from the sun. Next slide, please. I believe the slide talks about, we can stay back on the previous slide. I'm sorry, I thought I had a slide here about sunscreen. So in addition to wearing long sleeve clothing and having a hat, application of sunscreen, very, very, very important. 2 types of sunscreens. There are mineral-based sunscreen, which are the thick whitish color zinc oxide or titanium dioxide-based sunscreens, barrier skin protection. Or there are other also chemical-based sunscreens. Both of them are completely safe to use. Anywhere SPF between 30 to 50 is safe, recommended. The key to sunscreen is it needs to be reapplied every time the child comes out of water and every 90 minutes. The reapplication every 90 minutes is key because I think a lot of us do a very good job. We're going out of the house, make sure we put our sunscreen on, excellent, great. However, now we've been out for an hour and a half, almost 2 hours, the sunscreen is going to start wearing off. It's time to reapply. Remember to reapply. Rule of thumb, I always tell parents, like set a quick alarm for an hour and a half out, which reminds you like, oh, time for everybody to come in for a quick reapplication of sunscreen. Sunscreen is safe to apply to the face as well. Also remember the hairlines and the tips of ears for the kids. Those are areas that sometimes we forget and kids tend to get sunburned out there. Next slide, please. So now that we're out of the house, we have our hat, have our sunscreen on, off to the beach or off to the pool. We want to keep in mind water safety. Drowning is actually one of the leading causes of injury and death in children aged 1 to 4. It is not the depth of water that is the problem. Children can drown in as little as 1 to 2 inches of water. Even having like a little bucket of water out on the backyard or the deck could be hazardous. So the important thing to do is constant vigilance, constant having eyes on the child for the most part. In terms of pool safety, if there is a swimming pool in the house that you're living at or over in the holiday, going on a holiday home, it is imperative. It's that plenty of studies have shown that what really prevents any kind of drowning around pools is having a locked in fence around the pool. Not the backyard, but the pool itself should have a fence on all 4 sides, at least 4 feet in height, with no kind of lawn furniture around where anybody can climb in or out over that fence. And the other thing is that it should have a gate which has a lock, which is childproof. This has shown to be very, very protective in preventing any kind of accidental drownings or injuries. Yes, swim lessons are important and they definitely help. However, eyes on the child, that's the biggest safety net that we can have for our children. Next slide, please. There are different layers of protection. Some of them I just mentioned. Like I said, supervision is most important, is key. Even if the child is a good swimmer, we still want to have constant supervision when a child is in a pool. Ideally, we have an adult who's designated watcher, away from distractions like cell phones and things like that. And I always tell families, like, just switch out because it's tiring. Everyone's out of the pool, you want to hang out, socialize, and that's the idea, part of summer fun. And then everybody just switches out to make sure all the kids are safe and okay. Also, the younger the child, AAP recommends you need to be close enough to touch. So get into the pool, get into the water with the child while you're close enough to be able to hold on to them just in case something were to happen, versus being further away. Because keep in mind, when a child is drowning, it's always silent. They are not usually out and about screaming and shouting for help. They're usually just going down quietly. So eye on the child is super important, imperative at every moment that the child is in the water. Next slide, please. Heat exhaustion was another topic that I wanted to touch briefly upon. Is when you're out and about in the heat for a very long time, children can exhibit signs of heat exhaustion and then eventually heat stroke. Some of the symptoms would be they have increased thirst, they feel very, very tired, almost unable to stand, complaining of muscle cramps, nausea, vomiting, headaches, or they are profusely sweating and then they have a temperature, they have a high fever out of nowhere. So it's important to keep this heat exhaustion, sunstroke piece in mind. You want to move the child immediately to a shaded area, lie them down, elevate their feet, which helps the blood supply to go to the brain. If they're able to, offer them cool, clear fluids so that they can drink. If the child is unable to tolerate any kind of fluids because they're vomiting, or if they're having any kind of altered sensorium, they don't appear like themselves, you need to call 911 and bring them to the emergency room for immediate medical evaluation. Next slide, please. So to prevent this would be hydration continues. We already spoke about that. Plenty and plenty of fluids, plenty of water, even some of the foods like watermelon, other grapes, things like that, which have a very high fluid content. So even if the kid's not drinking water per se, at least they're consuming fluids like consuming foods like cucumbers, watermelons, which have a very high water content to help them maintain their hydration. Sun protection, taking frequent breaks, bringing them into the shade for a little bit, to prevent them from getting overheated over time. Another key important point that I do want to bring up here is that never leave kids unattended in a parked car. I know this sounds it may come across as something that, of course, we never intentionally leave our child behind in the car. However, we're all creatures of habit. And just in case there is some deviation from the norm where the parent doesn't typically drop off the child to work, but on that day is tasked with dropping off the child, but they forget about it, bring them, you drive straight to work, child has fallen asleep in the car seat in the back, and you just forget and go off to work, not realizing. And unfortunately, these type of situations have happened. So keys to prevent that is, if you're deviating from the norm, it's not your usual routine. The studies have shown that you put your cell phone or your bag or your wallet right next to the child, so that forces you to open the back seat door to take your belongings, and then making sure that the car seat is empty and there's no child in the car. And the other thing, and this is more so for the younger babies sometimes who are not verbalizing fall asleep kind of a thing. For slightly older kids, also teaching them if some of these signs of heat exhaustion, fatigue, where they need to know that they need to take a break, come indoors to cool down if they feel overheated. Next slide, please. Another point I wanted to touch about for a part of summer safety is use of insect repellent. Mosquitoes, it's rife for mosquitoes and other ticks. Our area is endemic for Lyme disease, so we need to be even more mindful about it. It is recommended for all children to use insect repellent. Recommendation is using a repellent containing DEET, about 30% of DEET. You want to apply a DEET containing insect repellent only on exposed skin, so keep it away from the face. For younger kids, you could apply it on a cloth and then kind of, or even on the clothing, on outside of their clothing. For younger infants, babies, you can put it on a cloth and have it right by where their bassinet is, if the infant is outdoors. Important thing is to, again, preventing insect bite is by if possible, wearing long sleeved clothing, avoiding exposure outdoors during the evening time. Usually that's when the mosquitoes are out and about the most, right around the time of sunset. And if required, using mosquito screens, mosquito nets around bedtime to prevent insect bites. Next slide, please. Summertime also comes with riding your bike and being out on a scooter and enjoying in the park and playground. Important to do that is to do it safely. Every time your child is on any set of wheels, be it a cycle, be it a scooter, be it anything that a skateboard, the child needs to have a helmet. It's important that the helmet is a well-fitting helmet, where it is covering the anterior part of the forehead and it's nice and snug around their head. It should loop around their ears and sit firmly underneath their chin, because any kind of injuries from a bike, scooter, skateboard, all of these, it could, and if the child were to fall and injure their head, they could suffer severe brain and head injury, brain trauma, and it's very easy to avoid it by just using a helmet. Even if the kids are out and about on a horse doing horse riding, they need to have a helmet on. The best way to encourage children to wear a helmet is by setting an example, making sure that if you're on the bike with the kid, you have your helmet on so that they will model good behavior by seeing their adult with their helmet on. Usually kids 10 to 15 years old prefer not to wear a helmet. That would be a very important age group of children to continue to encourage and teach the importance of wearing helmets. Even if it's on a short ride, doesn't matter. As soon as they get on any device with wheels, they need to have their helmet on first. Next slide, please. I believe that concludes my presentation, right? I'm happy to answer any questions. I wanted to give a brief overview of keeping our bodies safe and keeping our children safe through the course of summer so that they can have a wonderful, enjoyable summer with their friends and family. I'm going to take a look. Please feel free to drop in any questions or comments that you might have in the chat. And seeing none. See. What are some of the ways to make hydration fun and consistent for your family in the heat? That's a great question. I do get that a lot of times. So like we said, water, our key is to get the kids to drink water. Some innovative ways to increase water intake is make it fun with the kids. You can make flavored fruit infused or berry infused water. I have found getting a big jug of water, filling it with ice and having the kids pick out if they want, what colored water do they want. Strawberries, blueberries, sometimes mint and cucumber are some of the fun ways to give the water a little bit of a flavor and also a fun tinge and appearance, color to it. Another question, are there any routines or mindfulness practices that you have found helpful to keep stress low during busy summer days? Again, yes, things can get very busy, hectic, and packed during the summertime. Some of the routines that do work is trying and anticipating the day as much as possible ahead of time. With the very young ones, the toddlers, the kids, they do very well with consistency. As long as they know what to expect next, is very helpful. Um, Also trying to avoid rapid transitions, sort of giving them verbal cues to be like, it is going to be time to go indoors. We're going to be leaving in 20 minutes or in 10 minutes, in 5 minutes, and be like, okay, now is the time. So that just prepares the child verbally to be like, okay, this is what's coming. I probably do not like it and I do not want to go indoors. However, I have been mentally prepped. That helps keep the tantrums and outbursts on the low. The other thing which might help is making sure that the child is consistently fed, because it's often that their food timings are a little bit off. Like the kid is usually used to getting lunch at maybe say noon. However, it's now almost 12:30 and we're not ready with lunch, and that happens because it's a holiday or something, you're out and about. So keeping snacks handy, and being open and giving yourself grace, like yes, things are going to be off routine, however very soon it's going to be back on track.